I'm probably going to get some haters. There's going to be other dentists that are going to be they're probably going to be mad. I've wanted to express this for the past 40 years, and I don't know, I just felt I had to explain it at this point. If I were to go to the dentist, I'd ask them 3 questions. 1, do you sterilize your instruments and burrs? Well, of course. And how often do you sterilize them? And if they said they sterilize them multiple times, then I say, thank you very much, you're not the dentist for me, because what I'd want, and this is what I've done, I had a teacher that taught me this 40 years ago. This is called a drill bit. It's what we use to clean out a tooth, and we use it 1 time, okay? When people are sterilizing things, ideally they're gonna have it 99 9/10. You want 100% perfection. You don't want any mess ups when it comes to the sterilization. But the reality is, nothing is perfect. So we choose to use these things 1 time. But there's also another reason why it's really important to use a drill bit 1 time. And I call it's like cutting a tomato, all right? If you cut a tomato with a sharp knife, it's gonna just cut really nicely. There's not gonna be a problem. If that knife is dull, in other words, if the drill bit is dull, with the tomato, when you try to cut that with a dull knife, you get all kinds of collateral damage. In other words, the tomato, it doesn't cut. Okay, well, when you're using a drill bit, if it is a new drill bit, it's going to cut smoothly. A drill bit, when it's dull, starts to generate a lot of heat. And that heat can cause damage to the nerve. So what happens then, because of that excess generated heat, there are people, and I couldn't tell you the number, there are people that wind up needing to have root canals done because there's extra heat generated, and that heat was enough to damage the nerve that the person wound up getting a sensitive tooth, and they needed a root canal. So I wanted to say this for 40 years. When you go to a dentist, make sure they're using their drill bit 1 time. If not, it's like, see you later. I was talking to a friend of mine, his name's Daryl, he's a dentist, one time, and I asked him, I go, Daryl, we were talking about office overhead, and I happened to mention that I use these drill bits these things 1 time. He says, oh, no. He goes, I sterilized mine because, it costs too much to be getting new ones. I go, Daryl, if your daughter, Erin, was sitting in the chair, what would you do? He thought for 1 second, goes, I get your point. Okay, so I need to be able to sleep at night. I use these things 1 time. And as far as what do these things cost? So we've spent tens of thousands, but this is right here. This is one of the drill bits. And I don't know if you're able to see it, but what it says is it's $316 for 100 burrs. That comes to $3.16. If somebody can't afford $3.16 to get me a new instrument, it's like, I'm out of there. When somebody's having a root canal done, what a root canal is, it's a filling that you put inside the root. We use these little instruments to help put the filling in. Here's another one, okay? When you look at the cost of these things, right here, it is $42.62 for 5 instruments. That's approximately $8 for an instrument. If you're telling me that somebody's charging you for a root canal and they feel that they have to re-sterilize those things, it's like, again, I'm out of there, okay? Something else too, what we do, and hopefully everybody's doing this, what we do is when we sterilize our instruments, we do spore testing. It's this little thing right here. This is to ensure that your autoclave is working properly. Naturally, we assume that it's working properly. There's no reason to think that it isn't, but this is an extra check. So people use this to make sure that their autoclave is working properly. And I can tell you that there are autoclaves that people use in the country that for whatever reason it's mechanical, it can malfunction. Again, by using a drill bit 1 time, sterilization is a non-issue because it will never go in anybody else's mouth.